Good afternoon. It's just a week since the United Kingdom began the biggest vaccination program in our history, and the public is coming forward at an extraordinary pace to get a jab to protect themselves, beginning with the elderly and the most vulnerable. With 138,000 recipients of the first dose and more joining them every minute, there's no doubt that we are winning and will win our long struggle against this virus, which makes it all the more important that we hold our nerve this winter, because we're now in a race to protect us all while doing everything we can to keep the virus under control. And thanks to the colossal collective effort in November, we did bring the R below 1. We did get the infection rate down, but I must be frank with you, we're already seeing worrying rises in some parts of the country. Kent is still seeing rising infections. The number of cases in London is at 270 per 100,000 people. That's why we acted quickly by moving London into the third tier, tier 3 from today. And tomorrow, the Health Secretary, Matt Hancock, will announce the outcome of the latest tiering review. And so, like every other European country facing similar challenges, we've come to this moment, this great global festival, a turning point, a time of year that is of immense emotional, spiritual importance, but also a moment for us to exercise extreme caution, when we must remember that one of the most striking features of this virus is that it spreads invisibly from people who don't even have symptoms, which is in fact around 1 in 3 of everyone infected. And that's why from the beginning this virus has been so hard to fight, and that's why it's so important to follow the rules. And that's why this Christmas it's vital that everyone exercises the greatest possible personal responsibility. And having looked at the latest data with our colleagues in the devolved administrations, Scotland, Wales, Northern Ireland, we've decided that the overall situation is, alas, worse, more challenging than we'd hoped when we first set the rules. So while it would not be right, we think, to criminalize people who have made plans and simply want to spend time with their loved ones, we're collectively, across the UK, governments at every level, asking you to think hard and in detail about the days ahead and whether you can do more to protect yourself and others. We're keeping the laws the same, but we all want to send the same message. A smaller Christmas is going to be a safer Christmas, and a shorter Christmas is a safer Christmas. When we say 3 households can meet on 5 days, I want to stress that these are maximums, not targets to aim for. And of course, it's always going to be safest to minimize the number of people you meet. And that means that if you're visiting others over Christmas, we're asking you in the 5 days beforehand, as early as this Friday, to reduce the number of people you're in contact with to the lowest possible, because obviously this virus spreads through human contact. If possible, don't travel from a high prevalence to a low prevalence area, and avoid staying away from home overnight if you can. Remember, the vaccine is on the way, and our aim is to inoculate everyone who is clinically extremely vulnerable or elderly in the early months of next year. So if you're elderly, the best way to minimize your personal risk is to wait to be vaccinated before spending time indoors with others. And if you have an elderly relative, you might want to delay seeing them until they've been vaccinated. And whatever your plans for Christmas, please think carefully about avoiding crowds in the Boxing Day sales. And no one should be gathering in large groups to see in the new year. And remember, the rules in your local area will apply. In most places across the UK, I'm afraid that means you can't mix with other households indoors. And all the information about how best to protect yourself and your loved ones is being made available on gov.uk. So, have yourselves a merry little Christmas. I'm afraid this year I do mean little. But with the vaccine and all the other measures that we're taking, we do know that things will be better in this country by Easter. And I'm sure that next year, Christmas will be as normal, as usual, for every family in the country. And I'm going to hand over to Chris Whitty, CMO. Anything you want to add, Chris, to that?
Thanks, Prime Minister. I mean, really, I just wanted to, in a sense, re-emphasize some of the points the Prime Minister has made, but from the point of view of doctors and other healthcare professionals, because I think everybody would agree with what I'm about to say, who are doctors, nurses, and other healthcare professionals. And certainly this is the view of all the CMOs, Chief Medical Officers, and Deputy Chief Medical Officers in the UK. It's very important to situate the decisions that people are taking, the actions that people take over the next 2-3 weeks, in the fact that we do have a vaccine that will be protecting the most vulnerable to a very high degree of protection in the next 2 to 3 months. And that subsequently, as the vaccine's rolled out to the general population, the risk of coronavirus circulating will begin to go down. So we are tantalizing close to the stage where anybody who gets into trouble as a result of actions this Christmas would have been protected in the very near future. So it is very important people think about that when they make decisions over the next few weeks. And there really are, in addition to the standard rules and guidance that has been there for the whole time in all 4 nations of the UK, but certainly here in England, the guidance here, the tiering guidance the Prime Minister talked about, there are essentially 4 things to think about that are specific to the festive season over Christmas, as indeed to all the other major religious festivals, Hancock, for example, at the moment, previously Diwali and Eid. First thing is keep it small, keep it short, keep it local, and think of the most vulnerable people. Keep it small because the smaller the number of households that meet together over the festive season, the less transmission there will be. So smaller numbers in bubbles, smaller numbers that you meet in any other situation, all of this helps pull down the risk for your family, for your friends, and for the wider community. Keep it short because the shorter the period that people are together, the less risk there is of transmission occurring. Keep it local because people traveling from high incidence areas with a lot of transmission, to lower incidence areas, have the risk of actually passing on the virus. So wherever possible, keep it local. And in particular, think about people that you might meet, that your family might meet, or that one generation along people might meet, someone who you meet who then meets an elderly or medically vulnerable person who would very soon be protected, but at the moment is not, as a result of the vaccine that's rolling out. So just keep it small, keep it short, keep it local, think of the vulnerable. And that way we can reduce the risk at Christmas. We all accept there's an increased risk at Christmas. Nobody has hidden that at all at any point along this. But if we do this, we can reduce the risk further for everybody.
Thanks very much, Chris. Let's go to questions from the public and then the media. Let's go first to Teresa from Cambridgeshire.
With the significant increase in positive cases and more areas entering Tier 3, plus the news of a new variant of coronavirus that could spread faster, what evidence can the government provide to support the mixing of households at Christmas is not detrimental to our lives, pressure on the NHS and economy?
Well, Teresa, let me go first and just say that, as Chris has said, nothing in this whole campaign against the pandemic has been without risk, but we have to make a judgment about partly about how people are going to behave, anyway, people's natural instinct to want to see their families if they possibly can. And so what we're trying to do is to set the parameters that we think are sensible, and we've come up with a maximum that we think is sensible across the whole of the UK. But what we're saying today is that is a maximum, not a target. And we're saying, Teresa, that everybody should exercise personal responsibility, judging yourselves how best to reduce the contact, the meeting of other people that is the way of spreading this disease. And that's the way that we intend to minimize the effect of Christmas gatherings on the wider pandemic. It's about trying to reduce that contact and make sure that everybody is as cautious and as personally responsible as possible.
Well, I think just something which I think is, I think everybody accepts, which is this virus has forced us to make really hard choices between two bad options in so many other areas of life, and this is yet another one. The natural wish for people to come together at Christmas, which also it can be important for some people's loneliness, mental health, and other areas. So this is not just saying, well, this can't happen at all, is not without cost actually in the health side of things, leaving aside anything else, against the fact that the more people come together, the more different households come together, the more time they spend together, the greater the risk. And we're forced into this incredibly difficult choice where both the options are bad options. And the aim is to try and find some middle way between the difficult options we have to have. But people really must take seriously the fact they must minimize the risk by reducing the size, reducing the length of time, and reducing travel between high and low incidence areas, and particularly thinking about the most vulnerable.
Thanks very much, Teresa. Samuel from Leamington Spa asks, I think I'm going to read out Samuel's question. Samuel asks, will social distancing end once all the vulnerable are vaccinated, or will herd immunity need to be achieved before restrictions can be eased? Samuel's asking an incredibly important question. I think a few weeks ago, I spoke about, the potential crossover point when we'll have got enough of the vulnerable or the elderly vaccinated, ready to think very differently about the non-pharmaceutical interventions, the social distancing and all those types of measures. Were by no means there yet, but there will come a point, I believe, between now and Easter when that will happen. But what we're trying to do now, Samuel, is really massively accelerate, if we possibly can, that vaccination program for precisely the reason you identified. On the herd immunity question, I think I'm going to hand over to and how and when and how it might work. I'm going to hand over to Chris.
Thank you, Baron. So I think it's important to think about the vaccine in three different ways. Initially, we will help to reduce the number of people who die from this disease, but we'll need to keep the social distancing and other measures in place, because if we let go at that point, there'd be a huge surge, and people who are a bit below the highest risk groups, not the people at the very top of the age range and the clinically most extremely vulnerable, but people who are slightly below that, would then in very large numbers get infected. Some of those would get very seriously ill and end up in hospital, and some of those would die. So we will need to keep it on beyond that period, but that isn't going on all the way to the point where we get full population immunity, what's sometimes termed herd immunity, but really should only be applied with full vaccination. And that will occur, population immunity will occur, if we have vaccines which actually can reduce transmission between people. Now, at the moment, we have a high degree of confidence that the first vaccine that's being rolled out, the Pfizer vaccine, reduces the risk of people having severe disease and having clinical disease by a very large amount, not absolutely, but by a very large amount. And the data, although we don't yet have clinical authorization from the independent regulator, implies that the next two vaccines that are coming through also reduce the risk of people getting severe disease and indeed getting clinical disease. That's the Oxford AstraZeneca vaccine and another vaccine called Moderna, which is slightly further down the path. But we don't yet know if this leads to a reduction in transmission. It's likely to some degree, maybe not complete reduction. And if it doesn't do that, then we will never achieve this concept of population immunity or herd immunity. And then what we need is the vaccines to be at the highest possible rate, because only people who are vaccinated will be protected. But we hope that actually what we'll have is a vaccine that both protects the person who has them, very important for that, but also we hope will also protect people around them. It reduces transmission, but we'll have to wait to see whether that's possible over time. But what we will end up with is a period when coronavirus is still circulating. We're not going to get to a stage, it is not realistic to think we'll get to a stage there is not coronavirus circulating, but a much lower level. And there will be more deaths probably for the foreseeable future, but at a much lower level, just as every year there are flu deaths, on average year, maybe 7,000 flu deaths, in a high year, up to 20,000 flu deaths. This happens with infections, unfortunately, particularly in the elderly. And I'm giving a clear and complete answer, because this is a critical question. We will not get to the point there is zero risk. And a decision for society, led by political leaders, is going to be at what level of risk do we actually start to raise these measures. And that's going to be a difficult choice, but we're not anywhere near that yet. The key thing is over the next 3 months, we need to get these very vulnerable people vaccinated. Until then, this is actually a largely theoretical question.
Thanks very much, Chris. Let's go to Laura Kuenssberg of the BBC.
Thank you very much, Prime Minister. You're telling the country today to exercise extreme caution, but you are still allowing a 5-day period to go ahead when people from all over the country will be able to get together. Wouldn't it now be safer, clearer, and perhaps braver to ditch the plans to relax the rules over Christmas? And Professor Whitty, can I ask you, have you done any modelling of what the impact this period might have on the diseases? And if there are models, can you share with us what you think the effect of people getting together might be on how the pandemic spreads?
Thanks, Laura. Well, look, I want to be clear. We don't want to, as I say, to ban Christmas, to cancel it, and I think that would be frankly inhuman and against the instincts of many people in this country, the majority of people in this country. And nor do we want to criminalize plans that people may have made for some time, and arrangements that people may have made for some time now. But what we are saying is that that guidance, the 3 households and the 5 days, that really should be regarded as a maximum. That's the outer limits, and really people should think very, very hard about coming in under those limits and what they can do to minimize their own personal meetings with other people and to protect themselves and their family. And there are all sorts of ways in which we set that out in the guidance. We think that's the right way to do it, Laura. We think that people really do understand how this disease is communicated now, and we're offering a lot of advice, but we're also relying on people's strong sense of personal responsibility.
In terms of the modelling, yes, I mean, there's obviously a lot of modelling, and all of the modelling is published, so all of it will be available. What it shows, as is totally unsurprising, is that any kind of period where people come together in groups that otherwise wouldn't meet leads to an increase in risk, and that will lead to an increase in hospitalizations and deaths. And that has been consistently what we said will happen, not just scientists, but political leaders have said. But what we've tried to do is to then find out what are the things you can do to reduce the risk. And that's why I really wanted to emphasize, because these do come out of modeling as well as other data, reducing this number of households who meet up together to the lowest you can manage within this period, shortening the period of time, because shortening the period of time also really has an important effect, and reducing the movement of people from high transmission areas to low transmission areas. All of these, modelling and other forms of science, all make clear will reduce the risk significantly further than if we didn't do those. So really want to stress those are very important things for everybody to do.
Thanks very much. Carl Dinnan, ITN.
Thank you, Prime Minister. What should people do? Should people follow the rules that allow 3 households to mix for 5 days, or should they be following the slightly more tightly drawn guidance that each of the home nations seems to be coming up with? And could I also ask Professor Whitty, do you have an idea of what will happen to the transmission of the virus if large numbers of people stick to the letter of the law? In other words, have 3 households meeting for 5 days? And would you have preferred that law to have been tightened up today?
Thanks very much, Carl. Look, follow the guidance is what I would say to everybody across all the UK, and the rules, to repeat, are there set as a maximum, not a target.
I mean, just because you can do something doesn't mean it's sensible in any way. I mean, you wouldn't, for example, drive at 70 miles an hour if there was a very icy road, even though the law might say 70 miles an hour is what you officially can drive at. So people have got to take a lot of care on this. And this is the equivalent of us saying, these are icy and treacherous conditions. If we wish to have the driving analogy, we should be doing the minimum necessary still within the law. So just because you can doesn't mean you should. And what all the science would show is that the more that people feel that they can go down to smaller numbers of households for shorter periods of time, the less impact this will have in terms of upward impact on transmission. Obviously, if everybody pushes it right to the limit in every single household, that would be a significant problem. But I think it is very unlikely that will happen. My colleagues, medical colleagues across the UK, are having conversations the whole time with people about these kind of things. Most people are taking these kind of decisions, how many households to meet for how long, whether elderly relatives, how to manage minimizing the risk to elderly relatives whilst not leaving them excluded. They're taking these incredibly seriously as individual families. People having very difficult conversations in families to try and work out the best way through this. So I do not think everybody's going to take it to the limit. I think people are being, as always, as they have all the way through this, are going to be incredibly responsible about it in the great majority of cases.
Thanks very much, Carl. Let's go to Sam Coates of Sky.
Prime Minister, the law says one thing, the guidance says another. So if someone follows the law, but not the guidance over Christmas, and gives coronavirus to a relative who falls ill, whose fault is it? Is it theirs for pushing the boundaries, or is it yours for not wanting to toughen the law? And Professor Whitty, why do you think the eminent medical journals, the Health Service Journal and the BMJ, who jointly called for the rules to be tightened for Christmas, are wrong?
Well, Sam, I just want to repeat really what I've said to other of your colleagues, and we don't want to cancel Christmas. We don't want to ban it. We don't want to criminalize people for, planning that they've already made, and often very expensive decisions they may already have taken. But we do urge everyone to follow the guidance. It's there, and help to reduce to a minimum the number of meetings with other people that we have, because that's the way to stop the spread of the virus.
In terms of, you're getting a lot of commentary from lots of medical and nursing and other healthcare professionals at the moment. BMJ and the Health Service Journal, both very eminent journals, gave one particular view. What they all have in common is two things. Firstly, there is still a substantial and in many parts of the country rising problem. This is not a problem that's gone away. This is actually a problem in much of the UK, which is getting worse or flatlining, but flatlining at a high level. So this is not a moment to relax at all, quite the reverse. And secondly, that within the choices given, please take the most minimalist approach you can. And this, you hear this in different forms from lots of different medical outlets, but all of them will say that the key thing is do less. Now, some of them may say it should be the law, and some of them may say this is a matter of guidance, but all of them actually basically fundamentally say the same thing, which is do the least that you feel is appropriate for you and your family at this point. Go for the minimum, because we've got a very significant problem on our hands here.
Thanks very much. Let's go to Gordon Rayner of The Telegraph.
Thank you, Prime Minister. Prime Minister, does your approach to the Christmas lockdown mark a new, more perhaps mature approach to the way that you're treating COVID regulations, where people are given the information they need and then asked to use their own judgment and common sense to make decisions about their lives? And also, given that Wales has just announced another lockdown to start on December the 28th, not long after their firebreak, does that give you cause to question whether lockdowns are still the best way to respond to COVID?
Well, first of all, Gordon, I mean, alas, I respectfully got to differ with your characterization of this approach. It remains, alas, much against, I'm sure your instincts and everybody's instincts. It remains a highly prescriptive approach. We are saying very clearly that you can't meet in more than 3 households for more than 5 days. I don't think there's been anything like it, probably not since Cromwell's time, or heaven knows, when we've had something like this before. What we are saying is, because we do recognize that the human spirit will naturally want to celebrate Christmas and all the other festivals that people want to celebrate, that you cannot constrain people too much. You have to be reasonable. So what we're also saying is that if we want to stop the spread of the disease, which I think everybody does, then we need to look very carefully at the next few days and work out exactly how we can minimize contact, minimize the amount of time, and minimize the risk to the elderly and vulnerable. And that's what the guidance is there to do. It's there to help people to exercise personal responsibility over the next few days. And I hope it's useful. Thanks very much, Gordon. Let's go to Hannah Roger of the Herald.
Hi, Prime Minister. Hi, Professor Whitty. I've got a couple of questions. I think, first of all, for Professor Whitty, I was wondering if you have any advice for people who are planning to visit care home residents over the festive season, and whether, how that should interact with, if they're planning to see other households. Should it be the case that they shouldn't visit care homes at all if they're planning to meet any other households? And for you, Prime Minister, the Scottish Government said last month that every penny of its coronavirus Barnett consequentials would be spent on COVID-related issues. However, according to research today from the Scottish Parliament Library, the Scottish Government is now suggesting that as much as £330 million of this may be held back to cover the costs, any costs related to Brexit. I was wondering what you think of that decision, and if you think that Scotland has received enough funding to manage the end of the transition period. And just lastly, for the Prime Minister, seeing as everyone seems to be talking about Christmas, what gift have you got for Nicola Sturgeon this year?
I think you had a question first,
Okay,
Chris, about care homes. I'll try and think of a present for Nicola.
There is at the moment, in terms of I and the other chief medical officers, including the chief medical officer and deputy chief medical officers from Scotland, discuss this the whole time, because both from medical advice point of view and for individuals and their families, you're trying to balance two very difficult risks. The risk that someone who might have an infection unknowingly going into a care home and bringing it with them, and not only infecting their own relative, but potentially many other vulnerable people, completely accidentally, not intending to, against the fact that for many people in care homes, this has been a very long stretch. For many of them, they may be, in many cases, quite high rates of dementia. They may be quite lonely. For some, this may be the last few months of their life. So how do you balance the need to support the elder people, and indeed those who wish to see them, their families who wish to see them, against this risk to, but not only that individual, but the rest of the people who are living in the care home? And what we've all tried to do, and there are a variety of ways of doing it depending on the level of risk, is to say, well, at one point, the decision locally has to be made by the care home in consultation with the directors of public health and other professionals. But certainly in an England context, and the guidance is slightly different between the four nations, but not in essence. We try to take the risk down as far as we can. Have it PPE, increasingly using testing, which is not a way of taking the risk away, but it reduces the risk, and the amount of testing is going to go up in the next week, initially to help over the Christmas period, but we hope after that period. So testing helps reduce the risk. And then different levels of precautions, depending on the tier that the part of the country is in. So higher tier areas have more restrictions than lower tier areas never. Now, none of these are perfect solutions. What all of them are trying to do is balance these risks against one another. We're never going to take them down to zero, but it is a way of trying to allow these things to happen. And there is a slight relaxation of the rules for adults who are not older adults, but adults of working age, but are in care homes over the Christmas period here in England. It's a small seasonal change.
And Hannah, just on the Barnet consequentials, obviously they should be spent on the things for which they're intended. That funding should clearly go on the things for which it's intended. And as for a present for Nicola, I mean, well, there's all sorts of things that will arise naturally from the UK's getting a new relationship with our friends in the European Union. But one thing that may be of particular interest to the people of Scotland is that they will become the proud possessors of hundreds of thousands of tons of fish, shellfish, crustaceans, and I don't know whether Nicola's a keen fish eater, but she'll have more than she could possibly consume herself for a very, very long time to come. So how about that? Will that do? Okay, thank you. Let's go to Tim Ross of Bloomberg.
You said, Prime Minister, that you want to massively accelerate the vaccination programme. Do you hope that the Oxford AstraZeneca vaccine will be available before the end of this year? And when do you expect all over 50s will be vaccinated? And then, since you mentioned Brexit, just very quickly, 3 days ago you said you thought that WTO terms would be the most likely outcome. Is that still your view, or are you now more optimistic?
Thanks. Well, actually, I might ask Chris to comment about AstraZeneca because obviously I'm hopeful, but I've always been in the. You may not believe this, Tim, but I've always been in the kind of worried and skeptical camp on vaccines. I've always been anxious that we shouldn't over promise, but so it's incredibly exciting for me to see it actually happening now, and for the UK to be the first country able to actually putting a clinically approved stage 3 vaccine into people's arms. But I don't want to jinx things by over promising at this stage. And I'd really like to hear from Chris about that. And on where we get to with the EU. Well, again, that is very much a matter for our friends. They know what the parameters are, and we've just got to make sure that we control our own laws and control our own waters. And there's a good deal there to be done. But if not, WTO, Australia terms it is, and as I say, we will prosper mightily on those terms as well. But on AstraZeneca, I think I probably better leave it to Chris.
I mean, the dull, but I'm afraid real answer is this is absolutely in the hands of the regulator, the MHRA. They've got data which, when there's already published data, very impressive published data from the AZ Oxford vaccine in peer-reviewed journals, but they have access to large amounts of data that are not in the public domain. And their principal aim is to ensure safety as well as efficacy. So it's very important with any vaccine, we let them do their job free of any kind of pressure or external sort of hurrying along. They will do a professional job independently, as they should. I think there's a fair chance that by early in the new year, possibly before, but that entirely depends on the data, they'll be able to say whether they're confident that this vaccine is both efficacious and safe. And then what we will always then do is take a while whilst we assess it as it's being rolled out in a sense under ordinary conditions rather than under trial conditions, as we have with the Pfizer vaccine. We took a slow start just to make sure things were working, that anything rare that was picked up, we were aware of it, and we did actually alter the way that we selected people as a result of some of the initial people who came forward having some interactions, and that's led to an improvement over time. And we'll do the same with the AZ. We'll take it carefully and we'll build up. But it will, if it comes through, and this is an if, depending on what the regulators say, if it does come through, it does make it a lot easier. Not only is the volume going to be much greater, because with Pfizer, because there's a huge competition around the world for the limited stocks, every country has got a relatively limited amount of Pfizer vaccine for now, so it'll increase the volume. But importantly, it's also much easier to deploy beyond formal healthcare settings because it doesn't have the -70 requirements that the Pfizer vaccine has. And so that makes the flexibility considerably greater. So I think if we put those two together, if AZ comes through, if there aren't any last-minute hitches, it will speed up very substantially the period before we can actually get to the point the Prime Minister talked about, when those in the highest risk groups, which the JCVI, Joint Committee on Vaccination and Immunisation, has identified can all be vaccinated. So we all hope that will come through, but like the Prime Minister, the right thing to do is to wait and see what the regulator says.
Thanks very much, everybody. As I said before, have yourselves a merry little Christmas, but this year, alas, preferably a very little Christmas. But with the vaccine and everything else that we're doing next year, we hope it will be back to Christmas as normal for everyone. Thank you.